The federal government is still very much worried by the abuse of drugs in the country, and several committees and non-government organizations have been trying to tackle the scourge. A survey carried out by the National Bureau of Statistics, supported by the United Nations in the past 1 year, has revealed that 15% of the adult population of Nigeria abuse psychoactive substances. The highest abusers are people aged between 25 and 39, with cannabis being the most abused, heroin, cocaine, and other non-medically prescribed substances are also commonly abused. Young people, who are the highest users, now mix several substances like codeine, tramadol, and cannabis live on the wild side. Now, to tell us about some efforts being made by her organization to tackle drug abuse, I am now being joined by Funke Salako, Director of Programs and Orientation, Christ Against Drug Abuse Ministry. Many thanks to you, Funke Salako, for joining us on this hour.
It's a pleasure.
Before we get into what your organization is doing, why do you think that even with all of the campaign and enlightenment by government and organizations like yours, drug abuse is still on the increase in the country?
Really, our organization is doing a lot, but one organization cannot take care of this menace. It has to be cascaded from federal government to the local government level. What we have found out, even from our seeking partnership with government, is that government still has a lukewarm attitude, especially at the local government levels, where you can actually meet these people directly, where the impact can be felt strongly. They still have this lukewarm attitude, because we have actually talked to some local government chairmen and say, look, let us partner together to carry the message to the local government and talk to people, empower people in the local government service who can carry the campaign. Because really, if we have to reduce the scourge of drug abuse, it has to do with education, engagement, enlightenment. Because the more people you stop from going into drug abuse, the better for the nation. And from statistics, it has shown that it's the youth population that is actually very vulnerable. We're talking of the recent study, the recent survey by UNODC, that is United Nations Office for Drug and on Drug and Crime, that says that out of everybody evaluated in 2017, they found out that people between the ages of 25 and 39 were more culpable. So it says a lot to us, and it is not time to fold our hands and just say some organizations we are doing a lot.
All right. So again, before we get to what you're doing, and that's what I'm going to right now. Okay. Like you said, it's the youth, and a lot of people have said, look, maybe it's about unemployment, maybe it's about peer pressure. So what are you doing to ensure that these young persons that you talk about, you engage them in a way that the crime is no longer on the increase?
Okay, we have two ways of going about it, and that is prevention. Like I said before, we have started engaging youths from the teenage years, whereby we go to a lot of schools. Luckily, the Ministry of Education in Lagos State had been really friendly, and they have given us permission to go to some of these schools in Lagos State, secondary schools that is. And we are talking to teenagers in secondary school and letting them know the dangers. Because why these young people do this is because they don't know what they are doing. So a friend comes, you want to be my friend, then you do what I do. And because he doesn't know otherwise, he goes into it. So we are taking the campaign to schools, we are taking the campaigns to universities. And while we are doing this, we seek partnership with organizations, we seek partnership with TV stations, radio stations, even to carry this campaign out for prevention of people going into drugs. The idea is, let us stop them from the initial trial. Then thereafter, even if they have gone into this, if they are gone into drugs, what's next? We need to create centers where these people can be catered to, where they can be helped. We do that. We have 2 centers. We have one in Ekwe and we have one in Abeokuta, where we cater to almost about 200 people every year. And we are encouraging other organizations to also do the same.
All right. I wish we could go on because it's a very interesting conversation, but that's where we'll have to leave it. Funke Salako, Director Programs and Orientation, Christ Against Drug Abuse Ministry. Many thanks for your time.
Thank you.